What can I do to prepare for my child's surgery?
Great question. So surgery is really a team sport. And although your son or daughter has the hardest job in all of this, recognize that you are a key person in his or her recovery. Things you can do to prepare involve preparing things in the inpatient environment when they're in the hospital and setting things up at home so that they can be successful and get better and feel better as quickly and safely as possible. I usually encourage patients when they think about coming to the hospital, try and bring or assemble things there that's going to make them comfortable, and it's going to help keep them encouraged and inspired and motivated. So this can mean bringing pictures of pets, loved ones, bringing maybe a special blanket or a special pillow that they love or is going to make them feel more at home in the hospital. Making sure you have some things that they can be entertained with, whether that's bringing some books, whether it's bringing the iPad. Don't forget the chargers either. Okay, those are really important in the short term. When you think about getting at home, think about making their life easier once they're home after a big operation. So that may mean having them camp out on the couch, setting things up so that they're not having to climb upstairs, up and down. Maybe stocking the fridge or the pantry with some of their favorite treats. Again, this is a time for them to be pampered as they recover, and being a fierce advocate for your patient, or for your son or daughter rather, both in the hospital setting as well as in the outpatient world is really important too. So making sure that they're set up for success in terms of getting back to school, having a care plan, having a pain plan, having those things set up in advance, and having contingency plans is really important, and that's going to help relieve a lot of the anxiety that they feel, but also that you feel as well.
I think it's important to realize that preparation for surgery starts at the moment that you receive the news that surgery is going to be needed. Because at that moment, all of the worry starts, all of the questions emerge. The very best thing you can do to help a young person is to encourage them to talk. And the best you can do when they talk is to listen. I think it is the instinct of adults around young people to want to reassure a young person, to tell them it's going to be okay and that you're going to get through this. It's totally fine to do that. There's a moment and a place to do that. But before that, it's really important to let them talk about how they're feeling and to have them speak about the questions that are on their mind. That's respectful. And once they do that, then you can be better at responding to what's important to them.